Welcome, everybody. I'm really excited for this presentation. We've got Amanda Lattin with us, and it's been a pleasure meeting her and looking forward to learning more about aromatherapy and her experience. So as an introduction to Amanda, Amanda is a trained chemist, teacher, and practicing herbalist and aromatherapist. Amanda is currently a professor and the Aromatherapist and Spa Management Program Chair at American College of Healthcare Sciences. Amanda serves as a director on the board of alliances and of international aromatherapists. She founded her herbal and aromatherapy consulting practices, Terracina, Aromatics, and Herbals in Portland, Oregon in 2007, designing its line of therapeutic aromatherapy products. Amanda has serviced hundreds of clients with aromatherapy and herbal constituents and has collaborated widely with other holistic and allopathic healthcare providers to bring aromatherapy and herbal support to their clients.
Well, I'm happy to go. Thank you for such a lovely introduction. And I just got to meet Erin, and I believe we are like-minded individuals that are really interested in, lifelong learning and inquiry. And I'm really happy to be here today. I find essential oil bearing plants to be rather fascinating subjects. It's a deep well that we all get drawn into. We smell something, we experience something, we get curious, and then 20 years later, you look back and you're like, oh, where did all the time go? So I'm going to go ahead and jump into my presentation today. So what I will be sharing with you is a presentation that I wrote called Aromatherapy in the Context of Holism. And I started on this presentation a couple of years ago. I was asked to present on a holistic approach to aromatherapy and really supporting the pillars of health with aromatherapy. And as I started to work on my presentation, I realized that I first needed to dive into the question of what is holism. And many of us have an idea of what holistic means. Sometimes we have a concept of synergy around holism, or we think of holism as being, addressing the whole person. But that really begs the question, what is the whole person? And so I thought, well, I need to do a little bit of background research on holism itself so that I could orient my presentation correctly. And that was a rabbit hole, again, that I was not really anticipating the scope of. And as I started down that journey, I ended up reading 8 textbooks and over 100 research papers to really help wrap my head around that concept. So the first part of this presentation is really going to be asking the question, what is holism? And from a scientific perspective. And then we're going to apply that lens of holism to aromatherapy to see how that might drive how we would use aromatherapy, how we would assess a person's needs, and how aromatherapy might be able to support that person's needs. But also we're going to look at how that would change our approach to researching essential oils and to researching aromatherapy. So this first slide here asks the questions, why holism? Why do we even need to ask this question? And this is really a needs-driven question. From the perspective of medicine, we need solutions to chronic diseases, and our current methods we're not finding them with that. We need a different structure to the global healthcare system, because as we've seen, our healthcare system is enormous, but it may not be serving our population as well as it could be. We also need to create improved medical practice. Many of us have experienced this in our personal situations, but we also can see it from a professional level and a research level where we are not meeting the needs of the individuals that are coming into medical practice for care. Or from the other side of that, perhaps we're also not meeting the needs of the providers that are in medical practice. We've had great advances in technology, and we need to find out better ways of applying them to service our individuals. So we need to integrate our advances in technology into our healthcare system in a way that actually services the providers and the individuals appropriately. So this is really a necessity-driven approach to change our view of research on health and medicine. But more than that, the reductionist approach that we have been taking for the last 100 to 150 years has given us a lot of information on mechanisms and parts, but it has left us with an ontologically incomplete picture. And this really becomes important when we're looking at things such as chronic diseases and how to service, such a large global population. For healthcare, we need to have a better understanding ontologically of health. What creates health, what drives health, what can impact health, and how to support health. So having an ontologically complete picture is important, and a reductionist approach to research has not provided that for us. So we really need to have working concepts and understandings of wholes, W-H-O-L-E, as it relates to health, wellness, environment, and being fully human. So if we want to support the whole human, we really have to dive into the question of what does it mean to be human, and to not see ourselves as just isolated parts and mechanisms, but to really start to see how they interact and how also we interact with the environment and how we are a part of the environment. So really seeing these wholes and systems of wholes. And notice here in that quote that it's not just talking about disease and medicine, cause and effect, but to really see it more as a whole picture of health, wellness, which includes illness, of course, and that interaction between that. So it's much more dynamic and harder to study, I would say. So this is why we have holism. We took an approach to start diving in, especially in biomedicine, to start diving in at a smaller and smaller level. We wanted to understand cellular level, then we wanted to understand genetic level, and we have uncovered a massive amount of information in science with that approach. But now we have to kind of go the opposite direction, where we're zooming out to start to discover what are these wholes, what are systems of wholes, and how are we interacting with them to use that to drive our approach to researching medicine. So what is holism? This is not a new concept whatsoever. It's actually a very old concept. Ancient Vedic culture saw humans, they were described as sarva, which means whole, W-H-O-L-E. The academic term holism, H-O-L-I-S-M, was coined in 1926. By the way, Vedic culture is probably the oldest human culture that we have. Or one of the oldest human cultures that we have on record. So that's pre our culture, pre-dualism culture, but that's how they viewed humans. They were described literally as wholes. The academic term holism, though, was not coined until 1926 by Jan Smuts in his publication, Holism and Evolution. And that concept, that academic concept of holism, was really about an ontological ordering in nature to create wholes, W-H-O-L-E-S. And those were described as fields rather than fixed points of cause and effect, where any system or mechanism even would be viewed that way as a field, where towards the center, things would be much more concentrated and much more highly related. And then as you moved out across the field, it might not be as concentrated or as related. So you might be getting ready to move into another field, another whole, another system. So there would always be interaction between those systems and wholes, but the relationships might become more concentrated towards the center. So it's different than a linear approach or a reductionist approach of fixed points of cause and effect, rather to start viewing them as fields. And you could see how that could relate to people as well, where we could see people as a field, and you're coming and interacting with that field rather than, just fixed points of cause and effect in an individual. Holism, though, can also be viewed from other ways depending on how you're going to apply it. So we can look at holism as determining process or structure. The behavior of a part of a system cannot explain the behavior of the system of a whole. Or the properties of a whole are not determined by those of its parts. So this again is a different approach than just looking at a mechanistic viewpoint, where this approach of holism is saying we can't necessarily explain the system, explain the behavior of a system just by the behavior of its parts. And we can't necessarily determine the properties of whole just by its parts. And I think we can relate to that as people. You might be able to think about yourself, where your behavior as a whole cannot be explained by just the behavior of one part of yourself. And your property, like what do you do? What properties do you have, is also not determined by just one part of you. You may be able to apply that concept to even scientific work that you do. You might think about that idea or research that you have performed. So the 18th and 19th century critics of reductionist or mechanistic explanations of biological phenomena were referred to as vitalist, due to their proposal that vital forces drive the nature of life. But since the 20th century, this is not an accurate description, and usually the terms holist or organicist are currently used. So this is really distinction, creating a distinction here that holism in this sense is a scientific application. It's not necessarily a philosophical approach. I suppose you could see it as philosophical, but it's really looking at a scientific method as opposed to a reductionist approach. So modern holism development, it really developed out of a response to modernization of culture and society, and a mechanistic or reductionist explanation of biological phenomena. So as that reductionist philosophy became more defined and advanced, the holism approach was really developed as a counter to it. But again, this is not a new concept. We find this approach in ancient Vedic culture and also in ancient Chinese culture. And those approaches were not a response to modernization at all. So the modern approach to holism is really focused on quantifying change and quantifying complexity, whereas the ancient approach that we find in Vedic culture and ancient Chinese culture is not really focused on quantifying change or quantifying complexity. It's more focused on just noticing the qualities of change and noticing interaction between systems. So there's a lot of history actually in holism that I wasn't aware of when I first started. So how do we see this holism in the context of medical practice? So first, we're going to look at viewing humans as wholes, which is important. And many people might relate in medical practice to not necessarily being able to see a person as a whole, where we're really just focused on a particular problem or body system in a person. And it can be difficult to know how to approach viewing a person as a whole in the context of medical practice. We want to map ontological patterns. So when we're questioning how does something become something as wholes, and that could be, again, looking at an illness or a disease process or health as a whole consisting of fields rather than fixed points of cause and effect. We want to observe both structure and process as wholes determined through the relationships created by their organization and connection. And then we want to also identify opportunities for synergy. So synergy is a concept where most people relate to holism. They think of synergistic effects as holism. And there's an old quote that's attributed to Aristotle where it says, the whole is greater than the sum of its parts. And I actually discovered that that's a little bit of a misquote. The original quote was, for of all things that have several parts, and where the totality of them is not like a heap, but there is something beyond the parts, there is some cause of it. So he was saying that there was some reasoning behind how parts come together and interact as wholes and systems of wholes. But of course, that also speaks to the concept of synergy, where we see multiple things working together to create an effect that's greater than just them working alone. And I think like that's a good opportunity for us to begin to relate to looking for ideas of wholes and of holism, is this concept of synergy that we are more comfortable and familiar with. What is interesting about this is, as we, in the attempt to try to move past a reductionist or mechanistic approach to studying something, one of the major blockages was actually a cultural one and a language one. And we know culture often drives language. Language is often derived out of the culture. Because we have such a strong dualistic culture now, and especially in the sciences and in research and in medicine, the questions that we create are driven by that culture. We didn't really have the language to create holistic research questions, or to know which view to take or which questions to take to design holistic scientific research. So traditional Chinese medicine has actually been being used in research to help create perhaps a framework for what would the methodology look like to start creating a holistic approach to research. So pattern diagnosis or syndrome differentiation, which is also called pattern classification in traditional Chinese medicine, is being studied to discover how it correlates to the biomedicine model. And what's amazing about this research, if you have some time to dive into it, is the findings where they're actually learning more about these really chronic disease processes by utilizing this pattern classification and then applying it to the populations that have the disease. So I'll give you an example. One study was looking at I can't remember the exact number. It was many hundreds of patients in China with colorectal cancer. And so they all had the same diagnosis of the type of cancer that they had. And they asked the traditional Chinese medicine practitioners to apply a pattern diagnosis to each of these individuals. So that's what's different about traditional Chinese medicine pattern diagnosis as opposed to biomedicine. According to biomedicine, all 800 or so of these patients had the same cancer diagnosis. But within pattern diagnosis in traditional Chinese medicine, they had different groupings of pattern diagnoses. And so they they put the 800 or so colorectal cancer patients into groups according to the pattern diagnosis that they were given in TCM. And then they began to go through and try to discover if there were measurable biomedical marker differences between these groups. And indeed there was, and it gave them more insight into the different presentations. They wouldn't have ever even looked for these markers had they designed the research just around the colorectal cancer diagnosis. And so while this obviously in part was trying to look to see if pattern diagnosis had any merit in a biomedicine model, it was also helping to drive a more holistic, what would a holistic scientific approach look like here? And one of the key outcomes for taking a holistic approach in research or in medicine is individualized treatment development. And this is where biomedicine had hit a wall, where they didn't know how to individualize treatment for the people within this diagnoses, and utilizing the pattern diagnosis, which is outside of the biomedicine model, gave them an avenue to start looking for opportunities for individualized treatments. So this really aligns with the effort of using holism to understand both structure and process. That research that I'm talking about there could actually be its own presentation. It's really fascinating. Okay. So the holism of Vedic culture is also being used to employ further systems theory. Wholes and systems are mapped using cyclical causality models called holons and the Aristotelian four causes. I thought I had an example of this in this presentation, but I don't. And then these models are refined and tested using principles and symbols and language developed in Vedic philosophy. And while those ontological models are really geared towards biophysics, we can still apply them to help us understand the nature of wholes and a holistic ontological cycle. And what's really interesting about those cycles is that we often look at just the structure and the function of something. And in the holistic approach to that, they're really looking at context, and the context that the structure is in helps to drive the function. And really looking at something in a contextual approach rather than just looking at fixed laws is the big difference in the holistic approach rather than the reductionist approach. I had to read those biophysics papers a number of times, to be honest with you, to really wrap my head around the distinction of where is the starting point. And rather than looking at the structure and function as established or looking at structure driving function, that approach starts with context and seeing that the context that the system is in is going to drive function and then, of course, structure. And I really think that that's interesting as we think about ourselves being in context as well. Those papers and the holon cycles were really influential for me to understand this concept of holism. Another area that really influenced me and helped me to understand holistic science was holistic nursing practice and the integrative medicine view of humans as wholes. So holistic nursing and integrated medicine have adopted a view of humans as composites of mind, body, and spirit and their interrelatedness. And again, it's not just those three structure and functions, mind, body, and spirit, but also their interrelatedness. So holistic medical practice also acknowledges the patient's dynamic internal and external environment, and the healing or medical environment impacts health and wellness. As holistic medical practice has garnered renewed attention, there's been a lot of literature published regarding the definitions and participants. So basically the patient and the practitioner of holistic medicine or integrative medicine, but not as much attention has been given to exploring how holistic medical care is taught or practiced. I read this amazing paper, Incorporating Holism in Nursing Education through the Integrative Student Growth Model, and it was in the Journal of Applied Nursing Research. And they were driving the point home that in order for nurses to be taught holistic nursing practice, they had to be taught it in the context of a holistic culture of seeing themselves as composites of mind, body, and spirit, and learning how to be nurses, how to apply this, how to actually deliver medical practice through a holistic culture. And they were arguing the point that it had to begin with how the nursing student oriented themselves, even within their own education. So these were really key points for me learning to see where could aromatherapy, how could aromatherapy be viewed through this lens of holism. So it's important to note that holistic science and holistic medical practice have distinguished themselves from the term holistic medicine, which is used by complementary and alternative medicine or complementary and alternative therapies. While it is acknowledged the modalities and therapies which fall in these categories can bring more contributions to health and wellness, and patient care, it is viewed they do not represent the sum totality of holistic medical practice. And I think some of this is I'm going into this in detail because I think there's a lot of different definitions and uses of the term holism or holistic medicine. And I just wanted to say that what I'm talking about here, while it may incorporate some of those views, this is really more of a scientific approach rather than a philosophical one. So while these complementary and alternative modalities, such as aromatherapy, which would fall under that category as present, the argument is that they're not inherently holistic, but they have to be applied and taught holistically in order to really even understand what their role could be in holistic medical practice. So if you're involved in holistic nursing or holistic nursing education, I really recommend that paper. So after reviewing all of this research on holism, after looking at those cyclical models, the holons, and how they were being studied through ancient Vedic culture, and the holistic nursing diagram showing, that the nursing student really needed to be in a holistic culture as seeing themselves as a whole in order to learn holistic nursing practice, I created this diagram to try to help see aromatherapy in the context of holism. So here in the center, there's several rings here in this diagram, and they're not linear, so they're not cause and effect. There's not a priority here. It was just, I created this as a visualization to help try to conceptualize what are wholes and how could systems of wholes interact with one another. So the first ring here is the whole person, as we just discussed, a composite of mind, body, and spirit. And then these white arrows here help to indicate the interaction of all three of these. And then this next ring here is this person's life experience. So this is their worldview, their lived experience, their culture, and their prior knowledge. So they are existing in the world as a whole person. And then the next ring is how they are experiencing the world. So everything else that they interact with is going to come through that whole of their worldview, their lived experience, their culture, their prior knowledge, which would include their medical care. And I think we can all, again, relate to that. I think we have definitely experienced that, where we have seen someone else's culture influences their experiences or their prior knowledge or other things that they have lived through and experienced, or even their worldview. And then this next ring here I chose because this was, for my original presentation, this was the lens that I was asked to speak to, was, the pillars of health and how they can support a whole person, or also how can aromatherapy support the pillars of health for a whole, supporting the whole person's health rather than looking at maybe a disease model. So we can see these are, the pillars of health are non-replaceables for people. We all need them in order to be healthy individuals. Sleep, relaxation and stress management, our internal and external environment, exercise and movement, sunlight, fresh air, clean water, nutrition. And we know that we can't just choose one pillar of health, that we need all these pillars of health, and they all affect us. And within my paper, we actually discovered that they interact with one another. So our sleep will affect our relaxation and our stress management. It will affect our exercise and movement, and vice versa. The exercise and movement that we get affects our sleep, and same with nutrition, etc. And then the next ring is actually aromatherapy. And I think it was important to see that all of these parts of aromatherapy create the whole of aromatherapy. So it's not just the essential oils. It is a holistic support plan using the essential oils, which is built on integrative theory, which is built on inquiry and research, that the practitioner has to be giving themselves self-care in order to be able to service their clients in a positive and effective way, that safety is a key feature of all of these other aspects. That essential oil quality, which APRC is well familiar with, where we're looking at the analysis. What is the quality of the essential oils that we are utilizing? Sustainability. We have to have sustainability practices in order to have a complete aromatherapy picture. And then, of course, contextual and diverse learning, which we are participating in right now, hopefully. So if you wanted to think about, well, what is the system of a whole for aromatherapy? That was my attempt at looking at that. And I'm sure there could be many additions or different variations of that, but it was an opportunity to conceptualize it. So you see that aromatherapy is going to come through these pillars of health. It's going to come through a person's lived experience, and then it's going to reach the whole person. So there are these contextual opportunities to see interaction. And then this last ring here are the outcomes of the first 4 rings working together. And we see holistic wellness culture being generated. We see optimal healing environments being created. We see client-based care being created, and professionalism and collaboration. And of course, that whole is going to create effects and come through the system again, and it's going to begin again. So that's that opportunity for the context to be driving the function of something, and then of course to affect the structure of something. So it's really, that's kind of an orientation into that ontological patterning that I was talking about. And if I was in person, this would be my opportunity to ask if anybody has any questions. I hope that this is connecting, that you're starting to get a conceptualization of what I mean by holism. And one of those key outcomes there is that holistic wellness culture. And again, we talked about culture really drives language. And so as we start creating this holistic wellness culture, or even holistic culture in general, it might give opportunity for new language, right? And that language is going to help us further our research efforts and our understanding to this approach. So really interesting stuff when you start conceptualizing it. So how can we apply this to aromatherapy? Do we need a holistic approach to aromatherapy research and support plans to create better outcomes? Meaning, will taking this holistic approach in our research and how we're designing aromatherapy give us answers to questions we haven't been able to find yet? So we could take a holistic aromatherapy support plan vectors. We want to look for individualization. We want to look for opportunity for synergy, supporting whole persons rather than symptoms or disease. We want to try to assess outcomes holistically. What does that mean? And then, of course, we also have to ask critical thinking questions, such as what evidence is available to the aromatherapist to allow for individualization? Where is there evidence of synergy within individual essential oils, or within combinations of essential oils, or within the therapeutic actions themselves? Where is there opportunity to see wholes in an individual or in health? What does that mean? Where is there opportunity to see what changed in the whole person's in outcomes assessment? Many times when we're researching, so let's say we're researching sleep, we're only going to assess outcomes that we think are related to sleep. But if we broaden that scope and we started asking questions, what changed in the whole person, perhaps just as in that, the example that I gave with the traditional Chinese medicine, perhaps we would get insights into what affects sleep. We might see changes that we didn't expect to happen. And that might give us insights into what we're researching. And this is exactly what's happening in these areas of research around the pillars of health. where we've basically hit a wall where a mechanistic approach is not giving us the answers that we need to design medicine to resolve some of the chronic ailments that our population is facing. So in sleep research, holistic science sleep research, there are questions being asked like, what creates and regulates circadian rhythms and sleep? What causes circadian rhythm and sleep disruptions? And what establishes healthy circadian rhythm and sleep patterns? I mean, why are they asking these questions? Is because we are seeing more and more of the population being affected by chronic sleep disruption. And just giving them a sedative is not fixing the problem. There's many different types of sleep disruption, and it can be caused by a number of different factors. And the effects of them are not linear either. So we can see emotional experience and regulation can be affected. We can see an increased risk of anxiety and mood disorders, lowered immune function, changes in metabolism and increased risk of diabetes and obesity, maladjustment in diet and eating patterns, increased risk of cardiovascular disease, increased sympathetic and nervous system activity, and decreased quality of life. These can all be outcomes of chronic sleep loss. So while we might say, well, I'm okay, we might think that the only effect of sleep loss could be fatigue. We see that many body systems and the regulation of those body systems are affected by sleep. So we know that sleep is a vital human function, and that having it disrupted does not create a linear effect. It creates a holistic effect in the person. And then when we look at the causality of sleep, we see that it can be created also. Again, there's not a clear cause and effect. It can be created by many different life contexts, many different life experiences, like our work schedules or traumas. We could have an actual sleep disorder, aging, illnesses, normal life processes like menopause or pregnancy. Things could be disturbing our sleep, or we could have, poor sleep hygiene. These are just some of the areas that can affect sleep loss. So again, we can't really narrow it down to a specific cause and effect here. And even when you get into sleep research, this idea of circadian rhythms is really interesting. So 24-hour oscillations were first observed in leaves and plants way back in the 1700s. And it was really thought that light was driving that 24-hour oscillation, but they put the leaves in dark cupboards and they discovered that these patterns were still happening even without the light coming into contact with the leaves. And that really started the question of what creates these 24-hour rhythms. And since the 1960s, there's been a lot of progress in trying to understand that at a cellular and genetic level, where they're trying to understand, which gene is driving circadian rhythm. And then they find out that there's not just one gene involved, but there's also genes involved in feedback loops. And then looking at, well, what part of the brain is controlling this mechanism? And they really, first it was focus on one part of the brain, the suprachiasmatic nucleus. And if there's any sleep researchers listening to me, I really hope I'm doing your work justice here. But then we found that those genes are also in a range of different types of tissue. So that really points to seeing that it was a system of a whole working to create the 24-hour oscillation, this 24-hour circadian rhythm. It's not just one mechanism that's creating it. Of course, that would be super useful if we knew there was one mechanism that created it, because then we would know which mechanism to work with to help reestablish it. But the research is really showing that it isn't the case, that it is an entire system that creates that 24-hour rhythm. And as we can see, that makes sense, because there's a lot of outcomes of where the effects of disturbing it can be felt. And there's a lot of things that can disrupt that system. So aromatherapy research on sleep does show positive impacts on sleep quality, primarily short-term support for sleep disturbances related to anxiety. That's primarily where the aromatherapy research, what it really shows us. Their application methods showing positive impacts on sleep include essential oil inhalations, aromatherapy massage, aromatherapy acupressure, and then internal or oral dosing of essential oils. Most of the trials have been focused on lavender, lavandula, and gustifolia essential oils, and it has shown improvements in quality of sleep in different populations like college students, postpartum women, hemodialysis, ICU patients, nursing home residents. But then other essential oils have also shown sedative effects or positive impacts on sleep quality in both human and animal studies. So we really see a range here, not only in which essential oils have improved or positive impacts on sleep, but application methods as well, and many different types of people. It's not just one type of person and not just in one type of setting. So how could we have a holistic aromatherapy sleep support? Going back to those questions that I posed. We really need further research to allow for evidence-based individualization. We need to study aromatherapy for effects with chronic insomnia or circadian rhythm disruption. We need to study how different essential oils affects each stage of sleep, so that again would feed into being able to individualize, rather than just looking at a blanketed approach of using a sedative, essential oils that show sedative actions. What is really driving this individual's sleep disruption? Is there a certain stage of sleep that needs to be supported? And also, what is driving the person's sleep disruption? We can also diversify our aromatherapy support plan strategies beyond sleep alone, and perhaps we can address some of the other sleep loss effects. Like I outlined in my slide, we could see, well, maybe aromatherapy can't help this individual reestablish healthy sleep, but perhaps it can help support the individual in the effects of their sleep disruption. But despite these limitations, and what we would need to create evidence-based holistic support plans for individuals, aromatherapists are still supporting people in this area. So we really need to use our current empirical evidence to inform the research process in this area. And I really think this is an opportunity in aromatherapy research as sleep research is changing for it also to drive how we research the effects of aromatherapy on sleep. And maybe perhaps we could also borrow from that approach that is being taken with the pattern diagnosis in traditional Chinese medicine to also help offer us some insights in how we might change our research here. So I think there's a real opportunity. I'm just checking my time. This is just an example here. Another area that aromatherapy has a lot of potential for supporting the pillars of health and driving holistic science research is in relaxation. So this falls under, a self-management aspect of health. And this is also an area where I found really interesting research on holism. They're calling it techno-scientific holism. So due to the unsustainable growing cost of healthcare and management of long-term and chronic illnesses in recent decades, there's been a new movement in medicine developing to increase interest on promoting self-management components of health and well-being. And they're calling this systems medicine, or P4 medicine: predictive, preventative, personalized, and participatory. And a lot of pillars of health do fall under self-management activities such as exercise and relaxation, which is also stress management. So these pillars of health and those things in general are really difficult to study because there's a lot of factors that impact a person's ability to participate in those activities. The nature of their participation in those activities, or even meaningful assessment of the outcomes. So anything from a person's employment to their education, their socioeconomic status, and health conditions can all impact these self-management activities that relate to our health. So Anxiety is probably the number one reason people ask me for aromatherapy support. And I think that's a big, most people feel like they have some sort of anxiety in their life, or that they need stress management support. And obviously stress and anxiety are normal, healthy states in an individual. So anxiety is created by, it's a survival technique. We're responding to our environment. But when the anxiety and stress are out of balance, obviously that's when it starts to negatively impact our health. So we want to have that recovery time. We want to be able to recover from stress, recover from anxiety. So we want to have both. We want to have a healthy anxiety stress response, and we want to also have a healthy stress recovery response. So looking at, well, how can we individualize our aromatherapy support for people for stress recovery or stress management, if you want to look at it that way? We can see aromatherapy integrated into other self-management activities, stress recovery activities such as yoga, meditation, music intervention, even art therapy, Tai Chi, and it is being studied for these. And again, this is opportunity for synergy. It's an opportunity to address the whole individual, not just, trying to manage a symptom such as feeling stress and anxiety. But then we also want to take a holistic approach. And I think I will stop after this point and take some questions. I could go through each of these pillars of health, but it does take a while to get through them. So this is my last example here to try to show the difference, how we could take a holistic scientific approach to our aromatherapy research and our aromatherapy support plans. So here are essential oils showing anxiolytic effects in human or animal studies. And you can see that there's a range of them that have demonstrated that anxiolytic effect. So anxiolytic means reducing anxiety. These are the pathways the anxiolytic effects are attributed to. We see GABA receptors, sodium ion channels, serotonin receptors, and also dopamine receptors. So number of essential oils showing this effect, and also several pathways to create the effect. But this does not necessarily mean that we know how essential oils create anxiolytic actions, because there are several factors that affect in vivo essential oil effects. For example, synergistic effects. One effect balancing the other. The primary constituent in an essential oil acting as a contributor, but not the driving agent. And I think this is really an important piece for anyone who works with essential oils and aromatherapy to keep that in mind. We often just look at the top few constituents in an essential oil, and certainly we know that they are going to have effects. But then we've also seen where the primary constituent is not the driving agent, but it's rather a contributor for a specific therapeutic action. The essential oils could reach different types of neural tissue. And in vivo effects over time could be different than short-term effects that are measured in vitro. And also delivery methods. How the essential oil is delivered to the individual would affect all of these other categories here. So this is really a complex picture rather than just narrowing it down to, does this essential oil affect these pathways, or can we simply measure an anxiolytic effect? There are many factors here that would affect what we would actually see happening in an individual. So a different approach here would be through olfaction. So given the gaps in research on the in vitro radioligand binding for essential oils and comparison to the actual effects in vivo, that strategy that I showed on the other slide really might not be effectual, and it really doesn't allow for individualization in an evidence-based way. But a different approach that we could take is implementing aromatherapy as a relaxation or stress management technique through olfaction. And this really allows for systems interaction in an individualization approach, which would be holistic. So we all experience olfaction differently. And again, that goes back to the whole person, mind, body, and spirit. And also our response to olfaction is greatly influenced by our lived experience, our culture, our prior knowledge, and our worldview. It's very subjective and it's very individualized. So olfaction, that's our sense of smell, translates odors, odorant molecules, and essential oil constituents fall in that category, into information about the environment. And we just talked about anxiety is a response to information we have gathered from the environment. So this is about perception, how we are perceiving that information. And that's subjective. What one person might perceive as a threat, another person might perceive as being safe. The person who, and that will change their body's response to that information. So we have individual interpretation and responses to the information that we have gathered about the environment through olfaction. And introducing aromatherapy, because aromatherapy inhalations have shown positive outcomes in healthy volunteers in a number of different situational anxiety profiles. We know that by introducing aromatherapy, essential oils, to our olfactory perceptors, we are then gathering different information about our environment, and it can shift our perception of the environment. And so that's when we could see an anxiolytic effect happening, where really it's not a pharmaceutical response. It is our body's response to that change in perception of environment. And thus our endocrine and nervous systems respond to change our body chemistry. And, that creates that anxiety relief, stress recovery response. So I really think that this could be a opportunity again for holistic science research approach to studying how aromatherapy works and how we can individualize it in an evidence-based way. And it really might also give us insights into anxiety responses and stress recovery. Some insight into, aromatherapy in the context of holism. I hope that the introduction to holism was interesting for you and what holistic science research might look like. And I'm really happy to answer some questions. So I'm going to go ahead and stop sharing here. There we go. I hope that wasn't too much information too quickly. And
no, it was wonderful. Honestly, I learned a great deal. I think you presented it very well. And for a novice such as myself, it was digestible. And I think you did a great job. It was very educational. Thank you.
Wonderful.
So do have a few questions and perhaps some clarifications from some of the information you presented there. I'll just start here. One of the questions asks, do you see holism as competing with current medical practices?
I really don't. I think that, and if I had gotten to my slide on nutrition, there we go. So we see here, then these were French researchers. They were really gracious enough to let me utilize their diagrams in my presentation. So you can see here, reductionist study, reductionist study, reductionist study, reductionist study. We want to take that information from that reductionist study and feed it into these holistic scientific questions. Now, creating those holistic scientific questions, that's what I was getting at, where we're still learning how to do that effectively. Right now, we're feeding it with what are the questions we haven't been able to answer with the reductionist method? Where do we need to start understanding the complexity of context and how that drives the ontological process? This is currently how we are doing it, where we have a reductionist study, we get information, and we just keep circling within that reductionist mechanistic approach, but we realize that we're not feeding the information back to discover wholes or systems of wholes. And so the examples in nutrition that were shown is, well, we found that cholesterol can have negative impacts. So then the idea was to reduce cholesterol as much as possible, but then we discovered cholesterol was necessary for healthy function, right? Or we could do that with other things such as sugars, or, why do we have all these increasing studies on nutrition, yet we have not seen an improvement of health, even with more access to information on nutrition? And this particular study that these came from, which was really and really impacted me to read it, was showing that we needed to take all of that information that we discover through reductionist study and feed it back into a holistic scientific question. So I hope that helps to answer that question.
Yeah, I think it does. And if I could restate in my own words and correct me too, it's not that they are competing or in odds with one another. Perhaps it's looking at things in a different way, and so it is. They can be synergistically used with one another, and that's where perhaps the gap is bringing it all together, making it whole.
Yeah, and for a long, this is not new, but the reason it hasn't really been integrated is because it's so hard, because it requires really big data sets, and we really haven't had the technology to help us grapple with such big data sets. Before, I just attended a workshop from the NIH where they were looking at whole body research. And, we're really trying to tackle, how do we do this? What is the methodology? And then how do we interpret the data?
Excellent. Yeah. Thank you. That makes a lot of sense. This is a question that is applicable to me too, is what steps or tests could be done to determine where a greater balance in your life could be held? For someone who's new, these are new concepts. What things can you do to see where am I out of balance, if you will?
Yeah, I think that's a great question. And that's something that I ask my clients all the time. I really like to take it with the approach of what's a priority for the person. But sometimes when we have the priority for a person is a problem that they've had for a long time that really bothers them. And my experience has been that that's usually the last thing to change for an individual. So what I try to do with my approach with aromatherapy and herbalism is I try to say, okay, let's look at you as a whole person. So I know this is the thing that really bothers you the most, but let's start supporting you in the big picture. And they start seeing other changes happen, right? And that gives them encouragement, because oftentimes I find most people, what creates the most anxiety is they'll tell me it's not changing. I always feel the same way, right? I'm always hurting, or I'm always tired, or I'm always stressed, whatever that always is for them. And so as we start working with the person, if I only focus on that one issue, right, then we don't value the other changes that may start happening in that person. And as we know from research, these other factors do impact each other. And so for most chronic things, it's a slow change over time. And so I really try to help them engage with valuing the other aspects of themselves and other changes that they might see.
Yeah, no, that makes sense. Looking at the whole versus what seems to be causing the pain or the anxiety for you right now. One last question here, as you talked about traditional Chinese medicine, what would you say, as you've studied holistic sciences, what similarities and dissimilarities have you seen with traditional Chinese medicine?
Well, I think one of the advantages that they have, again, is the cultural support for that approach. And that is something that we simply don't have in Western society. And so because they don't have my interpretation, again, because there's not been that cultural block, they've been able to be more open to studying things from both avenues. And they do that consistently in their research that I have read, where they do both side by side. And I really see in Western culture, it's seen as separate. And I think that those studies that I read were really pushing us past being able to view it that way, to say, well, that's just holistic, or that's, that cultural approach, where they were able to show, no, in fact, this pattern recognition system does bear out in the biomedicine model. It's just the biomedicine model wouldn't look for these differences. And so it actually was able to perceive changes individual to individual that had the same disease process that we wouldn't even look for in the biomedicine model. And, again, that's saying, well, our technology has changed, but people haven't, right? Where these are patterns that we've been able to measure in individuals for a long time. We just haven't been able to apply our modern technology to that yet. So I think I see that as encouraging, because again, it's going to get overlaid disease process with a lens that we're not utilizing in biomedicine, but we're going to be able to use the technology and what we have learned through reductionist biomedicine research to further both. So they're, again, just like that nutrition slide, they're going to work together.
Great. Yep, no, that makes perfect sense there too. Well, thank you so much, Amanda. This has been great. I appreciate the time you put into this presentation and the opportunity to meet with you here today. Thank you so much. And we'll also be playing this for others to watch around the globe on their time. So thank you very much. We appreciate it.
I hope for anyone listening that if I touched on your toes, I hope I did it justice.
No, well, thank you so much. And thank you everyone for participating and listening in. And we'll close for now and see you again next time.
Bye-bye.